Hi everyone, this is Ishano Tekle. I am internal medicine resident at Sarasota Memorial Hospital. Today I'll be discussing about risk stratification value of laboratory test order sets for hospitalized COVID-19 patients. So this risk stratification uh, model is going to help the provider uh, to make decisions concerning patient's admission, patient's level of care, and treatment options. So this stratification can also help predict complication and prognosis of COVID-19 infection. So this current approach based on laboratory biomarkers actually can be combined to come up with a single score which can better predict the outcome or the predicting capacity of the model. So machine learning method has been used to evaluate risk stratification to see how probable COVID-19 patients are to transform to a critical illness. So the methods used here for the study, this is an observational retrospective study, and data was collected from the electronic medical record, and various statistical models have been utilized, including the univariate logistic regression, the random forest algorithm, and the Kruskal-Wallis test, and the chi-square test, depending on the type of the data. So continuous data was summarized with a median as well as compared with Kruskal-Wallis test, while discrete data was summarized using proportions, and this was compared using the chi-square test here. So coming to the findings of the study. So among 654 COVID-19 positive patients that are discharged or expired between March 14 and October 31st, 2020, 123 patients were found to progress to critical illness versus 531 which were progression free. So there was some comparison of some comorbidities in regards to progression to critical illness. As you can see here, diabetes, there was 52% versus 22%, while obesity has 42% versus 28%, anemia 35% versus 23%, progressing to critical illness whether they have these comorbidities or not. Based on COVID-19 clinical trait predictive progression to critical illness, this was retained by the RF analysis, and it was sequenced by relative contribution to model precision with the ROC curve. As you can see, the graph here is showing the biomarkers with decreasing significance, starting with lactate dehydrogenase, which has the highest association, 19%, followed by percent band, 17%, and total CK, 15%, C-reactive protein, 13%, D-dimer, 11%, and so on, as you can see here. And the table here has the cut point for each laboratory biomarker. As you can see, lactate dehydrogenase has greater than or equal to 364 as the cutoff point. Bands greater than or equal to 17%. So these values here, if patients have greater than or equal to these values here, they are more likely to progress to critical illness. And these all values are statistically significant with the p-values, as you can see. So to sum up this study, so this is our single-centered observational study and derived from machine learning approach, and it has identified 9 routinely available blood biomarkers, which are adjusted for age, for sex, for race, and other 39 comorbidities, and it's able to predict with high accuracy how likely patients with COVID-19 are likely to progress to critical illness. So the primary aim is to deploy an electronic medical record with an algorithm that tracks baseline and longitudinal likelihood of COVID-19 progression to critical illness. So this can rule in or rule out COVID-19 progression to critical illness. Thank you so much.